Let's talk about the wonder drug, Ozempic. Welcome back, everybody. It's Dr. Z here. I want to talk to you about semaglutide or Ozempic, truly a very influential drug and quite honestly a very effective drug. So we'll talk about what it is, what the indications are for its use, and how it actually works. So as I said, Ozempic's official name is semaglutide, and it's a GLP-1 receptor agonist or a glucagon-like peptide 1 receptor agonist, which means it activates that receptor to work as opposed to an antagonist which shuts it down. And it's typically used subcutaneously once a week. So GLP-1 is a hormone that your body naturally releases after you eat. It's going to cause the pancreas to release more insulin when blood sugar is elevated. It's going to reduce glucagon, which is a hormone that normally tells the liver to release more glucose. It slows down the emptying of the stomach so people feel more full, and it acts on the brain to reduce appetite so people feel more satisfied with less food. And this last reason is the bulk of why Ozempic became so famous. A lot of people were describing less hunger, fewer cravings, and just less food noise overall. And that's the key thing to focus on here. The reason people lose weight is still the usual caloric balance, which it always has been. But with medications like this, people feel less hungry, they need less food to feel satiated, and as a result, they end up in a caloric deficit, and it feels easier than it was without the medication. And the key is your normal GLP-1, that gets broken down within minutes. Whereas semaglutide or Ozempic, it's engineered to resist that breakdown, and that's why it has a half-life of about a week. And that's why it's a once-weekly injection rather than something that you take all the time. Now, who is Ozempic approved for? It's approved for type 2 diabetics to improve blood sugar control. It's approved for reducing cardiovascular risk for people with type 2 diabetes and known cardiovascular disease and or chronic kidney disease. In people with diabetes and known chronic kidney disease, it helps to reduce the rate of decline in chronic kidney disease, as well as the incidence of end-stage renal disease and cardiovascular death. And those are sort of the official medical reasons. It is used off-label for weight loss, and that doesn't necessarily mean it's wrong. It's quite a common practice, and it is legal when the evidence supports it in certain cases, and we'll talk about that. Even though it started as a strictly diabetic medication, it's no longer just about A1C. For example, Diabetes Canada recommends prioritizing certain GLP-1 agonists as well as SGLT2 inhibitors, which we'll make another video about, for people with type 2 diabetes that have cardiovascular disease, heart failure, chronic kidney disease. Even if their A1C or their diabetes is well managed, there's still evidence that these medications provide organ protection in those conditions. The American Diabetic Association, they formally elevated cardiovascular and kidney risk reduction as co-primary treatment goals with these medications rather than just glycemic control alone or diabetic control alone. Now, when it comes to the guidelines for using it for obesity, it's generally a BMI of at least 30 or 27 with those weight-related complications. People developing hypertension or high blood pressure, kidney issues, cardiovascular issues, diabetes, dyslipidemia, all those things can qualify somebody to be on this medication in the context of obesity. In diabetes, we'll generally see a 1 to 2% reduction in A1C with the use of Ozempic. Now, when it comes to weight loss, they did the step 1 trial where basically adults who were either overweight or obese but did not have diabetes, they received Ozempic at the 2.4 milligram weekly dose, which is the obesity dose, as well as lifestyle intervention. And the group receiving it lost an average of 14.9% of their starting body weight compared to only 2.4% in the placebo group who didn't get Ozempic. Now, obviously, that doesn't mean everybody's going to lose 15% of their weight, but these are just general numbers that have been seen in the data. Even 5 to 10% can be very beneficial when it comes to improving blood pressure, blood sugar, mobility, everything. Now, when it comes to the dosing, it's usually a stepwise increase. So typically, we'll start patients on 0.25 milligrams weekly, and that'll go on for 4 weeks. And if they're tolerating it okay, we'll increase it to 0.5 milligrams and see how they're coming along, whether it's their A1C or their weight loss, whatever the indication is for them. And if we still need additional control, we'll go up to 1. And then after that, 4 weeks of 1 milligram up to 1.5 and then 2 milligrams. And the reason it's done this way is because of the side effects. People can have severe nausea, vomiting, abdominal pain, constipation, as well as dehydration. So that's why it's important to go in small doses, let your body get used to it, and see if you're having any side effects before you decide to go to a way higher dose. And it's not about going on the maximum dose you can, it's about finding the lowest dose that produces an effective clinical benefit for you with the least amount of side effects. Now, the most common side effects, like we talked about, nausea, vomiting, diarrhea, abdominal pain, most of them are related to the digestive system. And usually people will have them when they start treatment or their dose is increased. So it may get better with time or it may not. So if you're having these side effects, definitely speak to your doctor. There is a chance that the medication is just not suitable for you. In a lot of cases, however, like I said, as time goes on, people will get used to the dose. These side effects tend to dwindle down. Now, when it comes to preventing the side effects, some of the things that have been shown to work is eating smaller meals. Remember, it's slowing down gastric emptying, so there's more stuff that stays in the stomach longer than it usually does. So it only makes sense that if you eat smaller meals, there's just less in there. Eating slowly and stopping when you're comfortably satisfied rather than eating everything on your plate or until you're overly full. Maintaining your hydration, keeping a regular bowel routine, making sure you're going to the bathroom, increasing your fiber. But again, if you're doing these things and it's just not working and you're continuing to have side effects, definitely speak to your doctor. You may need to reduce your dose or go to a different medication. Now, there are less common but more important and severe side effects and risks. Acute pancreatitis has been reported with these classes of medications. So if you have severe persistent upper abdominal pain, vomiting, pain radiating to the back, these are reasons to go to the hospital and be assessed. If you've had pancreatitis in the past, it might be worth a conversation with your physician or a specialist to see if Ozempic's a good idea for you. It's been associated with gallbladder issues. There can be an increased risk of gallstones, and usually this will present with pain in the right upper abdomen, fever, jaundice, or yellowing of the skin, of the whites of the eyes, pain that recurs after eating. These are signs of gallbladder issues, and again, hospital if you're having any of that. Like we talked about earlier, the medication by design slows down gastric emptying, but if this goes too far, or if it happens in somebody with pre-existing medical conditions, it can lead to severe feelings of fullness and vomiting and inability to eat, as well as major abdominal distension. So if you've ever had gastroparesis or GI issues, again, it's worth a conversation with your physician. It may not be the right medication for you. Now, an even rarer side effect that has been documented has been vision loss in one eye. This was added to the safety label back in February of 2026. Very, very rare, and the direct causation isn't established, but it is on the safety labeling for the medication, and it would be permanent vision loss. So obviously, if you're having that, that's certainly an emergency. It's called non-arteritic anterior ischemic optic neuropathy. Again, very rare, not common at all, but it is something worth noting. Now, when it comes to the thyroid, when they did the studies on Ozempic, it did cause thyroid C-cell tumors in rodents. It's unknown whether it causes medullary thyroid carcinoma in humans, but because of this signal, the guidelines suggest that anybody with a personal history of medullary thyroid carcinoma, a family history of medullary thyroid carcinoma, or multiple endocrine neoplasia syndrome known as MEN2 or type 2, they should not be using Ozempic at all. So if you have any issues with your thyroid, be sure to speak to your physician. It doesn't mean that just because you have Hashimoto's that you can't use Ozempic, but again, it's worth a conversation and understanding that there is a relation here with those particular conditions. Now, what about when it comes to regaining the weight? That's very common once people stop Ozempic. In that trial we talked about earlier, that step 1 trial, participants regained approximately 2/3 of their prior weight loss during the year after they stopped Ozempic. So that's quite a significant amount. And many of those benefits they had cardiometabolically, those also reversed in that time. That doesn't mean everybody regains every pound. It just goes back to how the medication works, right? So when you stop the treatment, appetite increases, hunger increases, and people start to eat more. And then once that caloric balance is out of whack and there's excess calories, the weight gain comes right back. So that's something to be very careful and mindful of. So always focus on the long-term plan. It's not some short-term shortcut. It'll always come down to your own habits, the way you live your life, whether you use the medication or you don't. Now, a couple other things worth talking about are muscle loss and Ozempic face. So when you lose a lot of weight, that can include fat, which is what we want, but it also can include lean mass or muscle. So Ozempic doesn't dissolve muscle in that way. But if someone's eating very little or they're consuming inadequate protein, and if they don't perform any weight training or resistance training, then the proportion of weight loss from lean tissue or muscle might become to the point where it's clinically important. Muscle is a very metabolically active tissue. It's expensive for the body to maintain and grow. So this matters a lot more for older adults, people with frailty, and anybody trying to maintain their athletic performance. Again, Ozempic is just one piece of the puzzle. You should be going to the gym, you should be resistance training, and that helps prevent any potential muscle loss from using the medication. So making sure you're getting adequate protein intake, regular resistance training, your overall vitamins, minerals, nutrition is on point, avoiding crazy or extreme calorie deficits, trying to get stronger. And Ozempic face is kind of in keeping with this. It's not some unique toxic effect of the medication. It just generally describes facial volume loss or loose skin after people rapidly lose weight or lose a significant amount of weight. Similar changes can happen after people have bariatric surgery or any other method of substantial fat loss or weight loss. So that's pretty much it for this one, you guys. Ozempic is a great drug in the right context for certain people. It's very effective at what it does. And like anything else that works well and produces results for people, it can get misconstrued. There's a lot of misinformation out there. There's a lot of people on it who shouldn't be on it. There's people who get it from very questionable sources. And obviously, don't do that, and be very careful with what you're doing and what you're injecting into your body. That goes without saying. But the medication itself, when used correctly, when used for the appropriate patient, is very effective. I use it all the time in my practice, and it's helped a ton of my patients. However, as with anything else, it comes with its own host of side effects and risk factors like the ones we talked about. So as always, it's worth the discussion, both with your physician and doing your own research and making sure it's the right fit for you. So hopefully that was helpful for you guys. Be sure to check out the newsletter in the community in the description. You can follow us on any podcast platforms that you want. And as always, let us know what you want to hear about next, and we'll see you next time. Cheers.